Hi, everyone. I'm Dr. Miriam Smith. Today's episode, I just want to welcome you again to today's episode on the Empowering You Nurses show. Today, we'll continue on menopause. We're going to talk just a little about the hormones. And these hormones are estrogen and progesterone. Now, we know that, as we talked the last time, these hormones are secreted by the ovaries on either side of the uterus. And they are the estrogen regulates the growth, the development, and of course the female characteristics like the breast and the pubic hair. Now the progesterone, that also what it does, it helps in preparation for fertilization and for after ovulation. If nothing happens, it prepares for pregnancy. So if nothing happens, then you'll have the shedding after ovulation. You'll have the shedding, which is of the endometrium, which is the menstruation. So therefore, that comes. It's so important to know that when all these hormones are declining, that's when the erratic phase goes on. Well, at the post, menopause has passed now after 12 months. After 12 months, consecutive months after the last period, that is the menopause. And the postmenopause, ovulation has stopped, estrogen has stopped. So then that's where that is. Now, if we just check back a little about in the perimenopausal period, you actually have the erratic period. And I did say that one can get pregnant at that time. So it's very, very, very important to take note. You can get pregnant at that time. Bear in mind also that estrogen helps with heart function of the cardiac vascular system, bone health, and the cognitive health. Estrogen helps in that. There is no specific there's no one test to say that a woman is in menopause, but there's a test that the doctor would do, that some blood tests involving the follicle stimulating hormone, FSH, and it has to do with checking the level of it. So the level, they check the level plus the cessation for 12 months after the last period. So they would come to the conclusion according to how elevated or how it is, the test that they would use. But there's no one test for this diagnostic, for that any one diagnostic test. So the recommendation, one going through different phases, should definitely consult their doctors. And some doctors might provide hormonal treatment, but on an ordinary basis, when individuals are going through this process, women, they might have you might listen to other women too. They'll talk about having a good nutrition, they might take hormone, they might do exercise to alleviate some of these. And of course, being dressed in layers, because sometimes the heat is it's really hot, and you have to change. I'll give you a change more frequently because you get sweaty. So of course, hygienic needs be met and all of that. I remember one of my friend told me some time ago that she was going on the Bronx River, and it was in winter, and she was so hot that she tell him, pull down the window, because it was really, really. So at that period, that time, when one experiences that, they just have to do the best they can. And as I said, some doctors might give hormonal treatment, some women will just go through the phase for a time and so forth and make themselves come. Some people take ice, some people open the window, all different. And as you talk to different women, you'll see different ways of how they try to cope or alleviate some of this. And of course, fluid, you have to hydrate yourself. With that in mind, those are some of the ways this process is being treated. Not everyone takes hormonal supplement or anything. And you have individuals who will tell you what they use during this period. So let me hope that someone learned something, and our nurses also will help some of our patients as they go through this process while they are under their care. I'm Dr. Miriam Smith. I can be contacted on Miriam Amanda Smith on YouTube, on Podcast Mirror, Instagram Podcast Mirror. I'm also on Apple, I'm on Spotify, I'm on Facebook, I'm Instagram, as I said before. Let me hope that this has been of some help, not just to nurses, but to other women who might be seeking some advice on this topic. Thank you. Thank you. Do well. Miriam Smith. Look forward to hearing from you again. Subscribe. Invite your friend. Tell someone about this. This is the Empowering New Nurses Show. Look forward to seeing you and hearing from you again next week.